Right, it's showtime. In 2022, the average amount that a Medicare recipient pays per month for a Medicare supplement, also known as Medigap plan, is $163 a month. However, the average cost of a Medigap plan is $150 per month, which obviously means that the average person is paying more than the average cost of all plans that are available to them. Now, to be fair, there are several factors involved in what the cost of a plan is. Things like the state you live in, being a smoker or not, your marital status, if a person is paying annually or monthly, and what your age is, just to name a few. Also, regardless of the cost of a plan, there are also several other very important factors that need to be considered as well before choosing a plan. Like, what is the insurer's rate increase history like? What is the financial stability of the company? And probably the biggest one of them all, what is their customer service experience and claims history like? So in today's webinar, we are not only going to cover the basic facts about related to Medicare, like we did in our Intro to Medicare workshop that we did earlier this year, and it was combined with our Understanding Social Security Disability workshop. But we are also going to discuss Medicare products and how they compare to each other and why it's so important to do this on a regular basis in order to make sure that you, as a Medicare recipient or pre-recipient, are getting what you need out of it for the most reasonable price that you can. Okay, so buckle your seatbelts, folks. Our workshop today is called Medicare 101 because it intends to not just introduce facts about Medicare, but to educate you about Medicare plans as it relates to price and features that most people have out there today. So, as you can see, based on just those few things that I just mentioned, there is a definite need for people to be more educated on these plans, especially when it comes to their similarities and differences. So that is exactly what we intend to do on this webinar today. My name is Brian Dougherty of PLC Financial Solutions, and I'm your host for today's webinar, along with my beautiful, wonderful partner in business and life, Rachel Dougherty. Say hi, Rachel.
Hey,
now, folks, we have a very special treat for you today because Rachel will not just be our moderator for it like she usually is, but since Medicare plans are what she deals with all day, every day, she will also be our designated specialist on the topic as well. So, Rachel, how does it feel to be our special co-host today as opposed to your normal, more passive moderator role?
It's very refreshing, I must say. That'll be nice. Nice to join in the conversation more. Absolutely.
Nice, nice. Before we get started, let's take care of some general housekeeping first. If the screen is not big enough for you to click on or big enough for you to read, you can click on the view options drop down at the top right of your screen to make it larger. Also, you'll see that there are two boxes at the bottom of your screen, one called chat, it's for your comments, and another called Q&A for your questions. Please use them accordingly, and Rachel will respond to them in kind. I'm sure that many of you will have questions about the material we will be covering today, but since we have a good bit of it of material to cover and only an hour to cover it, I'm going to ask you to put your comments and your questions in those boxes below. Or you can also email us at info@plcfs.com if that would be more convenient for you. And at the end, we will be staying for some extra time to cover as many of them as possible. However, if we don't cover yours, We'd be happy to answer it by either email or even a 15-minute Q&A phone call schedule for another time. Rachel will be posting a link for you to be able to book that if you'd like. Next, this webinar is being recorded and it will be sent to everyone who is attending tonight. So don't worry about missing anything. You'll be able to check it all out again at your convenience. Also, because we want to make sure that you're all paying attention, and because we like you to have some fun as well, before we answer any questions, we are going to have our usual 6-question quiz for you at the end. And the first person to answer each question right will, inside the comment box, will win a $10 gift card to a store of your choice. So make sure that you have your notebook handy to jot down some brief notes that I'll be pointing out as special bullet points that I will point out along the way. Finally, it's my obligation as a financial advisor and a fiduciary to inform you of our RIA's disclaimer statement, which is that our investment advisory services are offered through Fusion Capital Management, an SEC registered investment advisor, and we only transact business in states where we are properly registered or excluded or exempted from registration requirements. Our firm, SEC registration is not an endorsement of our firm by the commission and does not mean that our advisors have attained a specific level of skill or ability. And most importantly, all investment strategies have the potential for profit or loss. So now that we got that over with, I have one for you guys as usual. A hamburger walks into a bar and orders a beer. The bartender says, "Sorry, we don't serve food here." Yeah, I used it before, but it was good. I just had to go back to that well again, Rach. It was just had to do it. All right, so let's get started here. First things first, let's talk about who's eligible for Medicare. This is pretty straightforward. There's really 2 main classifications when it comes to it. The first is, and this is a bullet point already, get those notebooks out, jot it down. You're going to need it. People age 65 or older. So they're the first group. Got to be 65 or older to be eligible for. Now, there are some disclaimers to that. They also have to be U.S. citizens or legal residents and who have lived in the United States for at least 5 consecutive years. And it's worth noting that they do not have to be collecting Social Security retirement benefits to file for Medicare. The second group is people who are receiving Social Security disability benefits for at least 24 months. Although there are 2 exceptions when it comes to that as well, the 24-month rule. The first is people with amyotrophic lateral sclerosis, also known as ALS or Lou Gehrig's disease. And the second is people with permanent kidney failure, also known as end-stage renal failure or renal disease. They do not have to wait the 24 months. They can be approved immediately. Okay, let's go over the different parts of Medicare coverage. It starts with what is called Medicare Part A coverage. This is the part of Medicare that covers hospital-related expenses and is sometimes referred to as the hospital insurance part of Medicare. However, it might actually be more accurate to relate it more to expenses that involve skilled nursing care rather than a hospital, because it not only covers acute nursing care at a hospital, but it also covers short-term stays in nursing homes, rehabs that provide nursing care, skilled nursing care facilities, as well as home health care provided by a nurse, and even hospice care. So when you look at it, really, there may actually be more accurate that it actually covers more outside of the hospital by a nurse than inside the hospital. Here are some of the important points that you should know related to Part A. Bullet point 2. There is no premium for this coverage if you have all 40 credits paid into the Social Security system. And in 2022, Part A is $499 a month if you have less than 30 credits, and $274 a month if you have between 30 and 39 credits. Now, what it covers is it covers most inpatient hospital visits, skilled nursing care facility care, home health care, and hospice care as well. Next, individuals and their spouses are entitled to Part A. So it's not just the worker who has that time in, their spouse doesn't need any time and they'll still be qualified for it. It does not have a deductible. I'm sorry. Wrong. It does have a deductible. 2022, the deductible is $1,556 for a hospital stay of 60 days or less. And you have to pay that deductible every time you're in the hospital for 60 days or less. Wait a second. What did I do? I'm all over my notes. Did I switch the page? Yes, I did. You can go, and also you can go to any qualified hospital in the United States that accepts new Medicare patients. It's also available to all people on SSD. Like I said, after 2 years of receiving the Social Security disability benefits, as we discussed earlier. Now we can go to this page. Okay, a few more important details related to the deductibles and coinsurance of Medicare Part A are, okay, one, like we said, it has a deductible of $1,556 for each benefit period of 60 days. Two, the coinsurance for the first 60 days for each benefit period is $0. So you don't pay you really don't pay anything for the first 60 days that you spend in a hospital. Now, next, from day 61 to day 90, you pay a $389 coinsurance per day each benefit period that you're in there for that period of time. Now, next, the days 91 and beyond, you'll pay $778 a day coinsurance for each day thereafter, those first 90 days. However, after day 90, for each benefit period, you will be tapping into what is known as your lifetime reserve days, and you only get up to 60 of them in your lifetime. So once you use them up, basically you'll only be covered up to 90 days in the hospital before you will have to foot the whole bill. Of course, that is only for people who do not carry a Medicare supplement plan. And as you can see, this is one of the biggest reasons why a Medicare supplement plan or Advantage plan are so important. However, with that being said, and not to get too far ahead of myself too, but we are actually going to talk a good bit more about that. But a good supplement plan, our Medicare supplement plan, will cover these deductibles and coinsurance payments, plus any extended days in the hospital of up to 365 days. So just plug in that before I scared everybody to death with all those big numbers for the coinsurance. All right. So the second part of Medicare that's important to know about is Medicare Part D, or Part B. You should think of this as doctor's care and medical services insurance. It helps with the cost of doctor's visits and other medical services that do not require an inpatient hospital stay. Bullet point. In fact, we're going to have 2 bullet points back to back here. The annual deductible for 2022 for Medicare Part B is $233 of approved charges. Second bullet point, thereafter, Part B covers 80% of doctor's bills and other outpatient expenses, 80%. And standard monthly premium in 2022 is $170.10. Maybe less for some and actually more for others. And finally, beneficiaries with incomes that are over certain thresholds can pay more, up to actually 3.5 times more for this coverage. So, as I said, higher income Medicare recipients, when they make over certain thresholds of income, will pay more for their benefits than lower income recipients do. This is known as the income-related monthly adjustment amount, or IRMA. This chart shows the thresholds that different categories of recipients will pay at the different income thresholds in 2022. As you can see, for an individual, once they pass $91,000 in income, they start to see higher premiums. And for a married couple filing jointly, it starts at $182,000 and goes up in increments until it reaches $500,000 for an individual and $750,000 for folks filing married and jointly. Plus, the incremental premium increase starts at $238.10 and can go as high as $778.30 per recipient, which is almost 3.5 times the standard premium of $170.10. We're coming up, right? As soon as we get to some stuff, we're bringing you on, baby. One thing that's important to know is that you're guaranteed for your Social Security benefits to stay the same or not be reduced, regardless of the annual inflation adjustments that are applied to your Medicare Part B premiums every year. This is because of what's known as the hold harmless provision. Now, the hold harmless provision was implemented in 2006, and it basically works by the government taking each Medicare recipient's Social Security benefit cost of living adjustment increases, otherwise known as their COLA, and applying them to their Medicare premium inflationary increases. And then guaranteeing that if the COLA increase doesn't cover the entire inflationary increase, so if the COLA increase of the Social Security benefits doesn't cover the entire inflationary increase of the Medicare premium, then the government will pay the difference, thus allowing your Social Security benefit amount to be unaffected. However, it certainly is still a bit of a hardship because at the end of the day, by having your Social Security benefit cost of living increases get applied to your inflationary increased Medicare premiums, it prevents your Social Security benefit from increasing sometimes to keep up with inflation, which over time will seriously affect each recipient's ability to afford the basic things in life, especially if their Social Security benefit is the lion's share of their retirement income. Also, you do have to qualify to be covered by the hold harmless provision, and this is important. And currently, only about 70% of recipients actually are. So to qualify, two things must be in place. First, you must be receiving Social Security benefits or be entitled to Social Security benefits for November and December of the current year and in any given year. So that will only really affect people starting in their first year. And second, you must have your Medicare Part B premiums. This is the important one. You must have your Part B premiums, January through December, automatically deducted from your monthly benefits. So if you opt to pay for your Medicare premium separately from your monthly payments, then whether you know it or not, you are disqualifying yourself from the government picking up the tab on your Medicare premium inflationary increases every year if they have to. So make sure that you're having the monthly Medicare premiums deducted from your Social Security payments. That could be a big deal for you someday, especially if you start seeing your Social Security premiums go down as a result of your Medicare Part B premium going up from inflation. So make sure you take care of that. Although Medicare Part A and B are very good coverages, there are definitely some things to consider before you commit to them. One, they don't cover 100% of your medical expenses. Part A only covers up to the terms of its coinsurances, and Part B covers up to 80% of your outpatient medical expenses. Let's look at some of the things they don't cover. Part A doesn't cover personal convenience items such as a television or a radio or telephone when you're in the hospital. Private duty nurses, a private room when not medically necessary. Part B doesn't cover any routine vision, dental, or hearing expenses, and neither covers any custodial-based long-term care that may be needed. Second, their cost-sharing requirements between Part A and B can start to add up, especially if you're going to be in the hospital for a length of time in any given year. For example, deductibles for Part A, like I said, are $1,558 for every 60-day hospital stay, and coinsurance for hospital stays beyond 60 days being $389 per day for days 61 to 90, and $778 per day for days beyond that. This is, of course, could really break the bank in a worst case scenario. The Part B deductible for this year, like I said, is $233 before benefits kick in. But you still do pay at least $170.10 per recipient per month as well. And you are responsible for 20% of all medical expenses as well. Third, there technically is no limit on the out-of-pocket expenses when it comes to Part A. So these are some things that you should really think about before committing to a traditional Medicare plan. Now, let's talk about Medicare Part D before we get into Part C. Part D covers a recipient's prescription drug needs. Part D is made up of all voluntary outpatient prescription drug plans, which are offered exclusively through private insurance carriers contracted with Medicare. There are two types: standalone prescription drug plans, known as PDPs, and Medicare Advantage plans, known as MAPDs. Here are some important points to consider. Premiums and cost sharing vary. Most plans have a gap in coverage, also known as the donut hole. Rachel knows all about that, don't you, Rachel? Talk about that in a minute. Each plan has a list of drugs that it covers, and they are usually different for each carrier. You have to shop for a plan that carries your medication. Also, it's possible for you to end up with permanently increased premiums if you delay your enrollment in Part D, and with a gap in your coverage too for doing so. That's because there are penalties for delaying enrollment, and the longer you delay, the higher they get. Although there can be exceptions. If you have prescription coverage that they consider to be equal or better than their prescription coverage, which they call creditable coverage, because it can be credited or counted as equal to their coverage, then you don't have to sign up for a Part D plan. Also, again, like with Part B, Part D beneficiaries with higher incomes will pay a higher Part D premium. This This began in 2011, and it's part of the Part D IRMA, again, income-related monthly adjustment amount. And I'll show you that chart in a minute. Now, people with lower incomes can receive extra help, it's called, through Medicaid, who usually pick up the cost in that situation. So in this case, people who qualify for extra help, it's called, generally get their Part D coverage for free. Okay, so the Medicare Part D IRMA works the same as the Part B IRMA with the same exact income thresholds, but it starts with a $12.40 increase per beneficiary in premium and ends with a $77.90 per person increase when you get to the highest income threshold. That's on top of the current $33.37 base Part D premium per person in 2022. No surprise there. The more you make, the more they take. Rach, finally, you're on the hot seat now here. Can you give us your insight on what some of the top considerations that people should have when it comes to choosing a Medicare prescription plan?
I would say the first thing you want to consider is what kind of medications you take. You will want to check each plan has its own formulary, and you will want to make sure that, first of all, the medications that you do take are on the formulary. And also, too, you'll want to check, because some plans, they might have a very low monthly premium, but the amount that you're going to end up paying for your prescription drugs, especially if it's something other than generic. If you take all generics, a lot of times that's pretty easy. Most of them have, very reasonable rates for their generic drugs. But if you do take any brand medications or specialty medications, that's something you have to consider, because some of the plans, they might go off of a percentage base for their copay structure as opposed to a flat copay. And with the brand medications, that can get really expensive.
Right.
For sure. So that would be
we talk about those medications a lot. And I guess, if you're on a decent amount of them or a really important one, I guess that would be, would you say, number one thing to think about? Or
yeah, that would be the one thing you would want to look into is, number one, you would want to find a plan that has it on the formulary and also has good coverage for it as well. Yeah.
Okay. You heard it, folks. All right. So, starting off, bullet point. Better get it, Bob. Write it down. There is a Medicare option that includes all of the Part A, B, and sometimes even Part D coverages in one. And it's called Medicare Part C, also known as a Medicare Advantage, plan. It's made up of plans offered by private insurance companies. The major points for Part C are this. One, each plan must have Part A and Part B equivalents, insurance coverage. Two, beneficiaries may pay additional monthly premiums for additional services like dental, vision, hearing, annual physicals, prescriptions, silver sneakers programs, which usually provide like a gym membership with fitness classes of different types, etc. Third, beneficiaries may be restricted to go only to the plan's network of providers for their healthcare services. Four, the plan may not be available in all areas, just in case you move to another area while you're covered by one. Finally, each beneficiary's eligibility for enrollment is not affected by health or financial status, although there are special rules for people with special conditions. They may be limited to Part C's, what's known as their special needs plans, or SNPs, which are created for people with very specific conditions like diabetes and end-stage renal disease, think heart failure, those types of things. Also known as ESRD with the end-stage renal disease, but there are many of them. Secondly, how popular are Medicare Advantage plans? Well, approximately 42% of beneficiaries were enrolled in Medicare Advantage plans in 2021. And $343 billion, or 46%, of the total federal Medicare spending, net premiums went toward these types of plans. How does it work for the government to offer these plans? Well, each healthcare company's plan is paid a fixed amount per enrollee per year by the Medicare program. But each plan actually offers different features as part of their coverage, all of which must be absorbed by that fixed rate there that the government pays them. Rach, can you tell us how different coverages can be from one plan to the next in your experience when you're looking at Advantage plans and the different features they offer people?
Yeah, when it comes to the Advantage plans, there is definitely a wide range. You know, there's a lot of them that are pretty basic, but the great thing about them is that a lot of them do offer what they consider ancillary benefits, which is like hearing, vision, and dental, where you're not going to there is no hearing, vision, or dental with traditional Medicare. So once in a while you will come across a supplement plan that does offer some of that too, to put along with your original Medicare, but that's the one thing that I think a lot of people like about the Advantage plans, that it does have a lot of that. Also too, with the gym memberships, either Silver Sneakers or Renew Active is another popular one too. It does similar coverage with that.
And so is it fair to say that, you know, they could be completely different, the features from one plan to the next or amongst many plans?
Oh, absolutely. Yeah, it's different from one plan to the next, what they include. And it's also too, their copay structures are different as well. So it just does depend on what's, you know, a lot of them, there's lots of good plans. It just depends on what for any one person's personal situation, what's going to fit best. Right. Combination of coverage and monthly premium.
Absolutely. That's what I thought you'd say. Did I go to? No, I didn't go to. Now, folks, when it comes to Medicare Advantage plans, all things are definitely not equal, like Rachel just said. In fact, it is not uncommon for two plans to have zero premiums and deductibles annually, but have almost completely different terms, out-of-pocket maximums, and copays that are offered. In this slide, there are two different plans that we compared. The first, to the left, is called the Personal Choice 65 Prime RX plan, and it's a PPO, or Preferred Provider Organization plan. And we'll call this the PC65 plan moving forward, just to make it easy. And the one on the right is called the Humana Choice H5525-051 plan. And it's also a PPO as well, and we'll call that HC5525. The comparison actually has 8 pages of details related to both plans side by side. We are only showing you the first 2 pages to stress the point that as you can see, each comparable term is showing almost completely different terms in each. For example, on the first page on the left here, on the 3rd line down, you can see that the out-of-pocket network maximum out-of-pocket amount, let's say that again, the out-of-network maximum out-of-pocket amount is $11,300 for the PC65 plan. And the HC5525 plan does not even have a max number when it comes to their terms related to the out-of-network maximum out-of-pocket amount. Also, in the in-network max out-of-pocket is $7,550 for the PC65 plan and $7,200 for the HC5525 plan. As you can see, folks, as you walk down the line when it comes to their terms, even though some of the terms are the same, the vast majority of them are different. With that said, I can tell you from my experience of looking at these plans that it is like this for almost all of them, which means that when you are shopping for a Medicare Advantage plan, you really need to have access to a lot of plans in order to find the one that will have the best chance of suiting your needs. Now, Rachel, you work with these plans every day. What has been your experience with them when it comes to their costs and their terms? And what do you think is the best approach people should take when shopping for them? So now we're throwing cost into it a little bit, but just want to get your opinion on it.
Yeah, well, I think it's similar like what I was saying with the prescription drug plans. You want to weigh out, how much you think you're going to use it, or if you do already, say if you have a condition that maybe needs regular monitoring or like advanced imaging or something like that, you're going to be using that service. You want to make sure that you have that covered. And also too, I think a big thing when it comes to the Advantage plans, which is different than when you go with traditional Medicare and add a supplement with Medicare Advantage plans, you want to make sure that your provider is going to accept your plan. So, and with a lot of these plans, some of them one of the options that some of them have is in and out of network benefits. So some of the plans, they can bill to the plan and they'll get paid the same, whether they're in or out of network. It's not necessarily a different, a different rate that the provider would get paid. So that would be something to think about too. If they're not with the plan that you like, you can see if that plan has in and out of network benefits.
Yeah, that would be a curveball.
Yeah.
That's a good one. That's a good one. Didn't expect that one. That was a good one. All right. As we mentioned earlier, Medicare Part A and B only cover either up to your coinsurance amounts or 80% of your hospital and medical expenses. So most people opt to purchase what's known as a Medicare supplement plan. They are commonly referred to as Medigap policies because they primarily fill in the gaps where Medicare falls short. They too are offered through private health insurers, just like all the Medicare Part C and Part D coverages that we just talked about earlier. So I think at this point, it's pretty obvious why these types of plans are so important to have. The obvious answer is that they mainly pay for what most of what Medicare coverage doesn't pay for when it comes to the 20% of expenses in Part B, and most of the deductibles and coinsurance is related to both of them that the recipient is responsible for. Also, premiums can vary widely between different insurance companies for the same exact plan. This is where these differ from the Advantage plans. The supplement plans are all required to have the same exact coverage. Okay, so now there are things to consider, and I'll talk about them in a minute. But currently, the range between them can be anywhere from $0 to $160 and as high as $250 a month when it comes to supplement plans. Rach, do you have anything to add to this? What's your thoughts on supplement plans and maybe the differences or things that just related to the supplement plan that you think people should consider?
Well, I think the one thing about the supplement plans that is a little bit, it's more simple, I think, than the Medicare Advantage plans because of the fact that since traditional Medicare is your primary in that instance, where when you have the Medicare Advantage, that sits as primary. Although you have to have your Medicare, you need to keep up with your Part B premiums or you will lose your coverage when it comes to Medicare Advantage. You don't actively use your Medicare. And with the Medicare supplements, they, since they're just going along with your original traditional Medicare, when it comes to picking a provider, as long as a provider accepts Medicare patients and there is no, there are no
can't be turned down.
Yeah, no, there's no issues with that, and then you don't need to get hospitalizations for anything. They don't. Yeah, they don't require prior authorization. So there's that difference too, where you will run into that with the Medicare Advantage plans.
Absolutely. So they seem to be a little more standardized, can we call it?
Right. Yeah, absolutely.
And I guess the point I'm pointing out here is that for them to be so standardized, it's amazing the cost differential from one company to the next when they're so standardized.
Oh, yeah, absolutely.
So that's something I think people need to consider as well. We're not going to get into this too much, but here's a list of the types of benefits that come with most of the Medicare supplement plans. As you can see, they do get pretty specific as to what they cover, mentioning the fact that they will cover the first 3 pints of blood one receives, because Medicare coverage doesn't cover them. And even a certain percentage of foreign travel emergency services received as well. However, what you can clearly see on this chart is the fact that Plan F covers all the basic expenses that people incur when Medicare Part A and B don't
Thanks,
cover.
guys.
With
Thank
the
you, Michael.
exception
Thank
of foreign
Thanks, Mike.
travel
Appreciate it.
emergency expenses,
We'll
including
send a-
only being covered.
All right,
up
we'll
to
send a recap.
80%. And this is why this plan
Awesome.
was the most popular for so long. But in 2020, they were discontinued for individual new recipients, but were godfathered in for folks who had it prior to that. But they still have them for groups, right, Rach? So,
Sorry. Yeah, they still do have them for groups. I couldn't get my mute off.
okay, no problem. So now the new most popular plan is the Plan G, which offers all the same coverage as Plan F did, with the exception of paying for the Medicare, or not paying for the Medicare Part B deductible, which, like we mentioned earlier, is currently $233 for the year. Rach, what is your experience when it comes to these plans, when it comes to the group plans that you see? As far as you had talked about F before when we talked about this, and which of these plans do you think are most popular when it comes to group? And by the way, Rachel mainly deals majority in group Medicare plans.
I would say the F plans are actually probably some of the most popular, not, since they still can carry them, a lot of them do have F plans, but I'd say, F mostly is what I see for the most part.
Yeah, which was pretty much the trend before 2020 with the individuals too.
Mhm.
Okay, now let's look at a side-by-side comparison of 3 different Medigap plans. Okay, folks, now that you know all the services that Medicare supplement plan covers, let's look at the reality of what the marketplace bears when it comes to them. Here, you're looking at 3 different plans. First is a Medico insurance company plan on the left. The second is an SBLI USA life insurance company plan in the middle. And the third is an AARP plan on the right. In this example, all 3 plans offer the exact same coverage, but all 3 of them are charging a different annual premium. The Medico plan is charging $124 a month. The SBLI plan is $131.96. And the AARP plan is $141.34. As you can see, you could be paying more for the exact same plan than you would with another carrier. In fact, I have seen even more extreme cases when it comes to the premium differential for these plans as well. I've seen them I seen one not long ago, was like close to $250. And it had the same exact standard coverage. Also, a side note though, in 2022 is that the Medigap plan seems to be offering the cheapest plan. It seems to be offering the cheapest cost at the moment. Now, to be fair, there are other factors that weigh in on this as well. And we hit on them a little bit at the beginning of the workshop. Things like each company's rate increase history, their financial stability, which will reflect in the company's ratings. And like I said before, the biggest one is their customer service experience and claims history they each have. So sometimes it may actually be worth it to pay more for these things, but not always. It may be worth it in some cases when it's a higher rated plan or reviews are better for a plan when it comes to claims. Talk about your experience between companies and how each of them pay rates and these types of things, claims history. What are the types of things from one to the next that you've seen?
I say they're vastly different. They really are. There are some carriers that are, there's never an issue with or real easy. Then there's other carriers that it's like, there's always some kind of issue or things are delayed or, a lot of back and forth trying to get claims ironed out. So it really is something, it's something you definitely want to look into before you sign on with a plan for sure.
And you know this because in your day job, you actually have to call the carrier sometimes, right?
Yeah. So it's a lot of some of them, like I said, some of them are really easy, but it can be a challenge with some plans. So I mean, that's why sometimes even, especially if my biggest concern is for people that have doctor, maybe if they have a condition that they're having monitored, they want to make sure that doctor, their specialist that they're seeing, have a plan that their specialist would recommend or works well with their office, because that is definitely a big issue for some people that they run into problems with their specialist getting paid.
What do you hear from some of the providers as it relates to some of them?
Some providers, they get to a point with some plans that they won't take the patients anymore. And they have to find, a new, and it's heartbreaking sometimes because some of these people that are older, they're in their 80s and 90s, and they've been going to the same, doctor for the last 20 or 30 years. And then all of a sudden they're having to go, farther away to a different doctor where they have to start all over again. So it's, can get really frustrating.
Absolutely. So this is the point I'm trying to stress to people, that it can be really different from one to the next, and it's worth doing your homework and really to try to reach out to somebody who has maybe the inside track of understanding these things a little bit to help them get a more insight. Does that make sense?
Absolutely.
So with all that said, you should definitely shop around, if not annually, maybe every other year, for the best price with the best company that you can get. Now let's quickly talk about the enrollment periods that most people are eligible for at different times based on their situation. These are very important to be aware of, because if you do not abide by them closely, you could end up being penalized, and in some cases, the penalties are steep and permanent. So pay close attention to these. First is an automatic enrollment period to Medicare, which only really happens when a person is receiving Social Security disability benefits already. They don't have to do anything. Their Medicare benefits will start automatically after 24 months of receiving benefits. That's called the automatic enrollment period. Next, what is known as the initial enrollment period applies only to people that are turning age 65. It actually starts 3 months before the month you turn 65. It includes the month you turn 65 and then continues for 3 more months after you turn 65, for a total of 7 months in the period. So when you turn 65, as long as you apply within this time frame, you will not incur any penalties. Then there is the special enrollment period. This applies when a person is still working when they turn 65 and thereafter. This period starts on the first day that person is no longer employed and no longer receiving health coverage from their work. And it runs for 8 months from the date that their employment ended. Again, as long as you file within that period of time, you will not incur any premium penalties. Okay, so the next two enrollment periods have nothing to do with any one individual or age of a person. These are time frames that anyone eligible can apply every year. The first is called the general enrollment period. It runs from January 1st to March 31st every year. If you sign up during this period, your coverage will not begin until the month after you apply. That is actually new. And this January 1st, 2023 is the first time it will work like that. Before, a person's coverage wouldn't start until July 1st, the year they sign up during the period. Did you know that, Rach? Yeah, this January is the first time that they're going to actually have people during the general enrollment have their coverage start the following month instead of the following July.
That's nice.
Yeah.
Yeah.
The other is called the annual election or open enrollment period. And it runs from October 15th, Com's birthday, our son, to December 7th. And it's coming up in a few weeks from now, actually. And it's during this time when qualified people can either join, switch, or drop plans as they wish. Plus, if you sign up during this period, your coverage will begin on January 1st of the following year, as long as the plan gets your request by December 7th each year. Okay, Rach, anything to add to this? Thoughts about the enrollment periods? Things people should know about? Pitfalls, anything?
No, yeah, it's just, I would definitely say whatever deadlines, this is one thing I know, whatever deadlines that Medicare sets, say if you do have a special enrollment period, or if you're going to go during open enrollment, especially if you have opted out for whatever reason, or you fell behind in your Part B premiums and you're no longer enrolled, whatever deadlines they give you, you have to, they are not very forgiving. I'm actually trying to help a woman right now who fell behind in her Part B premiums, and her check arrived 4 days after, because they gave her till March 31st of this year. The check went in the mail later, got to Medicare on April 5th, actually, I think. And they sent her check back and they said, sorry, call us back. And, you know, so now she's got no coverage right now. You know what I mean? We're trying to fight it with a supervisor, but yeah, you have to, it's very cut and dry with Medicare. So just keep an eye out, you know,
absolutely.
keep that in mind.
Can't stress these things enough. Okay. Now, let's also talk about what can happen if you don't enroll in Medicare at the correct time. On that note, right? Part A, if you have to buy Part A and you don't buy it when you're first eligible for Medicare, your monthly premium may go up 10%. And you'll have to pay that higher premium for twice the number of years you didn't sign up for. So if you delayed for 2 years, you'll have to pay the extra 10% for 4. Now, for Part B, the penalty for not signing up at the right time is a permanent 10% for each full 12-month period that occurred from the end of your initial enrollment period to the end of the general enrollment period each year. Ouch, that hurts. 10% a year gets worse. Plus, your premium can actually increase every year moving forward because the formula being used for this penalty is based on a percentage of higher Part B premiums due to inflationary increases. They're using a percentage of whatever the current Part B premium is. And we know that goes up pretty much every year, right? Side note, COBRA is not considered creditable coverage for Part B, delayed enrollment. So it can actually cause you to be penalized if you delay signing up for Medicare because of it. Part D penalties. Part D Medicare calculates the penalty by multiplying 1% of the national base beneficiary premium, which is $33.37 in 2022, times the number of full uncovered months that you didn't have Part D or creditable coverage. That monthly premium is rounded up to the nearest dime and added to your monthly Part D premium bill every month permanently. So, Rach, have you talked to anyone who's had incurred these penalties before?
No, well, the woman actually that I was just talking about before that lawsuit, she's going to end up with a penalty once she does get re-enrolled. And then there was another gentleman that I helped. He was really resistant. He wanted to put it off until January. He was 65 in August of this year. No, I'm sorry, he was 65 in June. He delayed his enrollment until August because he didn't want to have to pay the extra money. So he delayed it, but I really had to lay it out for him a few times, and stress that if he waited until January, how much extra he was going to have to pay forever. So again, it's another one of those issues. There's no, once you're there, it's not very forgiving.
Absolutely. Glad we have some real life examples here. Finally, we would be remiss if we did not discuss the 3 different ways you can apply for Medicare when you're ready to do so. The first is the Medicare only online application. To do that, you actually have to go to the Social Security website, which is ssa.gov, and sign up for an account. Then you go to the Apply for Benefits tab and go through the process. You'll get to a question that asks you to apply for Medicare if you want to apply for Medicare only. And this is if you do want to only apply for Medicare only. You have to click yes to that, to do that. And it's that easy. Because a lot of people are waiting for their to get to their full retirement age benefit to take their Social Security. Because they can they have to apply for Medicare at 65, but they're delaying Social Security till they get to their full retirement age. That's very common. Anyway, when you go on there, it takes about 10 minutes, allows you to apply for Medicare on your own work record, but it will not allow you to file for a spouse to file, allow you to file for spousal work records or spousal benefits. You can file for Medicare Part A only or both Medicare A and B if you want. So you can do both. Must be at least 64 and 9 months old before you can file. If outside the initial 7-month Medicare enrollment period, you may be asked to provide proof of employer group health coverage to verify that there is no penalty for the delayed enrollment. Second way is to sign up in the office, the old-fashioned way, everybody used to do it. Go to ssa.gov and do a search for the closest SSA, Social Security office near you. You could sign up for an appointment online, and you won't have to wait in line when you get to the office. That used to be the big nightmare, right? Go and wait for Social Security for 3 hours or 4 hours when you used to just walk in. So you can set an appointment now. And then the third way is to sign up by phone. And you can actually schedule a phone interview and do it by phone if you prefer. So, folks, you have plenty of choices on how to sign up these days. It's your choice. You make it. All right, folks, that concludes the educational part of our workshop today. But before we jump into our 6-question quiz and our Q&A for it, I want to make a very special offer to everyone that is attending. I want to offer everyone here with us a no obligation complimentary Medicare plan comparison quote. And I want to take a minute to explain a little about what that entails and what you can get out of it. So this is what it entails. First, you'll have to set a meeting with us to do it. You can do this by clicking on the 60-minute meeting link that Rachel will be posting in the comment box right now. Then, once you book the meeting, you will immediately receive in an email from us that will have in it a link to an online Zoom meeting. Because our Medicare plan meetings are all done using Zoom, which is an online platform for doing meetings like the one that we're on now, except that it's one-on-one, it's a one-on-one meeting. If you have never done an online Zoom meeting, they work almost just like we are doing this webinar, but instead we'll both be able to see and hear each other, and it will be completely private. Second, our Medicare plan comparison quote is done through a 2-step process. First, we would meet so we can get your current plan details and to run you a plan comparison and send you the quote that day. Second, we would meet a second time to go over that quote with you and to answer any questions that you might have about it before you make a decision on whether you want to go with us or go with our plan or not. And if you do, we would start the sign-up process then. Finally, what you can get out of this is a clear understanding of whether it would be worth it or not for you to move to a different Medicare plan with us. And of course, at the very least, you would get a much clearer understanding of your own current Medicare plan and why it makes sense to stay with it. And we will be the first to tell you to do so if that is the case. So if you would like to take us up on this no obligation complimentary Medicare plan quote, Rachel will be posting in the comment box a link to book a 60-minute meeting with us. All you have to do is click on the link during our 6-question quiz or our Q&A session, and you will be able to schedule a time at your convenience directly on our calendar today or whenever you're ready to do so. I do want to mention, though, that all our Medicare-based meetings will start next week on Monday, 10/3. Also, if you have any questions that you would like answered before you book, you can schedule a brief 15-minute Q&A phone call with us to do that as well. She will also be putting up a second 15-minute Q&A meeting link too. Plus, folks, we will be leaving this Zoom meeting open for a half hour after this webinar ends today, so that if you would like extra time to be able to copy and paste anything, any of the information that we've posted in the comment box or Q&A box, you'll have plenty of time to do so. Okay, that's it, folks. So let's jump into our 6-question quiz and our Q&A session. All right, let's see. Any questions out there, Rachel? Looks like we got a few by email here. What? Looks like we got one from Patsy here, right?
Yeah, sorry, I was having trouble getting to my, I wasn't unmuting.
Okay.
You're gonna do questions first and then the quiz?
No, I'm sorry. Let's jump into the quiz first. I'm sorry. Got ahead of myself. Okay. First question. Here it comes, Bob. Not too quick now. Give everybody a chance. First question. What age do you have to be to qualify for Medicare? Gonna put the answers in the Q&A, right?
Okay. Yeah, it looks like it was Cindy.
Cindy, 65. Good one. Write that down. Also, too, Cindy, if you can, tell us where you would like your $10 gift card from. Second question, which part of Medicare out of A, B, C, and D has no premium as long as you have paid into the system for at least 40 quarters or 10 years? So that's either part A, part B, part C, or part D. Hey, Linda got good one. All right, Linda, that was a good one. You want to tell us where you want your gift card from? We do a lot of Amazon ones. People pick Amazon a lot, but it's up to you guys. But third question, which part of Medicare, again, out of A, B, C, and D, has an annual deductible that's currently $233?
Cindy got B.
Cindy again, nice. Part B, that's correct. All right. Fourth question, what percentage of your Medicare bills does Medicare Part B cover? What percentage of your medical bills does Medicare Part B cover?
Oh, Bob got it.
Bob got it. There you go, Bob. You got one. Good. Everybody's on it. Fifth question. Which part or plan that Medicare offers includes Part A and B and sometimes D all in one?
Bob got it. Medicare Part C.
That's right, Bob. Good job. Now, final question. What is the name that is used for Medicare Part C plans? Two different answers. You got it. Come on, come on. You got it, folks. They use a name for it. And I'll give you a little hint. Its initials are MA.
There you go. Bob got it. Medicare Advantage.
There you go. Pulled it out of nowhere, Bob. All right, good one. That was a little bit tougher this one time around, right? I mean,
It was.
weird. I did the bullet points. Just a little tougher.
Well, you know, it is a tough topic. There's a lot of moving parts to it. So
That's true.
hard sometimes when you do it all the time, it makes sense. When you're just hearing it doesn't necessarily.
That's for sure. Okay, so for the Q&A, Patsy has a question. What's it say? Top one.
I think it looks like she was just clarifying. I don't know, maybe we weren't clear enough when it came to your special enrollment periods. If you're working and you have coverage, you will not get penalized as long as you have credible coverage.
Yeah, if you're still
And you're-
working after 65 and you're getting coverage by your employer and you have a letter from your employer stating that you have had coverage, you will not have to pay any penalty. Yeah, that's
Right.
true. That's
Yeah.
true. That's true, Patsy.
Yeah, I think maybe we just weren't, maybe that was not quite clear. Like I said, when you're used to dealing with it, it's easy to gloss over things and think, not realize that it's not coming across clear. Another question is if you're already on an Advantage plan but are working, but wondering if you should go with a regular Medicare and a supplement, what is the difference between supplement and Medigap? So that
Nothing.
actually, no, yeah, that's it. I was just gonna say, that was actually one of the notes I made. I was gonna, because some people get confused by that, but actually it's like they're the same thing. It's just two different terms for the same thing, is a Medicare supplement and a Medigap. Like I talk to some people, sometimes they get really upset that they're like, but I want a Medigap, and well, it is, they get upset with me because I'm referring to it. I guess just the way it came into, I refer to it as a supplement all the time. I usually don't refer to it as a Medigap.
Yeah.
But a lot of people, I think just like from like commercials and stuff, I think a lot of times they refer to them as Medigaps when you see stuff on TV. So sometimes people get really upset that you're not showing them a Medigap plan, but it is. Yeah, they're the same exact thing. It's
I
just two
think of
different
it,
terms.
if you just think of the word gap is just filling in the gaps where regular A and B, fall off,
Right.
come short. And that's what a supplement or Medigap plan is.
Yeah.
I think that's kind of where the name came from.
Oh, yeah, absolutely. Yeah, just it supplements your original Medicare.
Right, filling in that gap. So we got a couple here by email too. You want to read that?
Yeah, I see them. Okay, so says, if I'm working now, when do I file for Medicare?
Okay, like we talked about, right? It starts the first date that you're no longer employed and you are not on your work coverage anymore. And it runs 8 months from that day. And that's when your special enrollment period is, they call that, right? Special enrollment period. Yep. So, okay.
Okay, so the next question, if I miss the time period after I turn 65 to enroll, when can I enroll again?
That's a good one. So you can either either or you can enroll again during the open enrollment period, which is October 15th to December 7th every year. Or you can start again, you can enroll January 1st to March 31st. During those periods of time. The only difference now is that, say, if you enroll October 15th, you won't start coverage to January 1st following year.
That's what I was just gonna say.
Yeah, but if you do it January 1st, you'll have it at February 1st.
Which is different. That usually you had to wait until July before.
Yeah,
So that's huge.
Yeah, it's a real big deal. Real big deal. Next one.
Alrighty, so if I'm on a Medicare Advantage plan now, can I go back to can I go back to a traditional plan without any problems?
That's a good question. So you can definitely go back. The only caveat is that if you do have some medical issues that you didn't have initially, you could end up being rated or charged more for a Medicare supplement plan. And they're allowed to do that. They can't turn you down, but they can charge you a lot more. So that could, they could preclude some people from being able to do it because they may not be able to afford to. They can go back to the A and B, no problem, without being charged anymore, even if they have, any types of conditions, but they can be charged more going back to with the supplement plan.
I think too, one thing you want to make sure of, keep in mind, if you're going from an Advantage plan that includes your prescription drug plan, if you go to a supplement plan, you're going to need to pick up a separate prescription drug plan
Oh,
that goes
yeah,
along with it. So
that's
you
a
got to
good
make
point.
sure, because you don't want to, it's the same thing as with the, you don't want to go without a prescription drug plan, because if you, since it's a standalone, if you go without it for more than 60 days, then you're going to end up with that enrollment penalty when you enroll back into it.
Yeah, yeah, yep, there you go. That's a good point. Final question here.
All right, yeah, there's one. Do you recommend a Medicare Advantage or the traditional A, B, and D with a supplement?
I'm gonna let you take that.
Oh, that's mine. Okay. So I'd say, well, like I said before, it really does depend on your own personal situation. How, like, what is your health like? Do you have any health conditions that need certain attention? Are you a snowbird? Do you live in the north over the winter and then, live down south for the winter and come up north for the summer? Because sometimes with that, if you're moving around, it's a little bit easier to have Medicare as your primary as opposed to the Medicare Advantage. Because then you don't have the issue, with trying to find providers that take the plan.
I think it's a budgetary issue sometimes too.
It can be, because a lot of times the Medicare Advantage plans tend to be a little bit more budget friendly a lot of times, because with the supplement plan, you're paying for the supplement, you have to pay for the prescription drug plan separately. So that, that is definitely something to think about.
And also too, your health. If somebody's in good health, pretty good health, have, always taking care of themselves.
Yeah, well, that's what I mean. And that's why I'm saying any one given situation, if you have a certain condition that needs certain monitoring, you're going to pick a plan that makes sense for that, or because with the one thing I think that a lot of people don't realize, one of the differences with the Advantage plans to the traditional Medicare and supplement plans is that with Advantage plans, a lot of times they require prior authorizations for things where the Medicare Advantage plan, or I'm sorry, the traditional Medicare, there are no prior authorizations. So if you're needing to get other services, outpatient procedures or advanced imaging, things like that, those are things you're going to constantly be needing to get prior auths for. And there is a chance that the insurance company is going to say, no, we don't think that you quite need that. So that is something to consider.
Yeah, absolutely. Here's one from Cindy. My husband will be 65 in March and will continue to work. When should he file? So Cindy, he would have a special enrollment period when he decides to stop working. And that will begin the first day of when he's not working and not covered. He's no longer employed and not covered under that plan. So, and the most important part is no longer employed.
I think right? Too, I think the one thing you want to consider with that is, some employers let you keep your coverage for a certain amount of time. They'll say, okay, we're going to cover you. So it's kind of up to you too. Like, how long are you willing to go without coverage? Like, you can start the ball rolling before you actually retire. You can make sure that, and you can contact Medicare and let them know when you want the start date to be. You don't have to wait until you're retired to start that, because then you could have a time where you don't have any coverage. You can plan it out ahead of time and say, usually it's about 60 days prior to that retirement date, if you know exactly when it's going to be. And then you let Medicare know it's always going to start on the 1st of the month. And then that way you could already have your Medicare and whether you go with an Advantage or a supplement plan already lined up to kind of like pick up the very first day that you're not going to have coverage from your employer anymore.
Yeah, I guess the one thing to add to that, I guess it's a small company, 20 employees or less, then Medicare will be the primary coverage, right? And if it's a larger company, I believe the company coverage will be the primary. Is that
right? Oh, well, you mean if he starts at one?
If you get into a situation where you start Medicare prior to leaving the job.
Oh, right. Well, that's why I'm saying you don't necessarily need to start the Medicare. You can start the ball rolling for the process, because it's going to take, it could take 6 to 8 weeks sometimes to get your Medicare ID number, you know,
Right.
so it's not like you're not going to call them and they're, you know, you're not going to get it that afternoon when it's, you know, fill out your form. They don't just send it right back. It's a little bit of a process.
Right.
So
Right.
you can start that ball rolling and let them know when you want the start date to be. And then that way there's no, like, you know, overlap or anything. You would go right from, you know, your employer plan would end on the 31st of a given month, and then your Medicare and supplement or Advantage plan would start the 1st on that next day.
Yeah, I mean, absolutely, to be seamless. I think the obligatory part of it, though, as far as the penalties are concerned, starts the first day you're not employed. And then you have 8 months to go, just in terms of the penalties.
All right, yeah,
That
absolutely.
doesn't mean you should do it like that, like in terms of keeping your coverage. And that's a good point to bring up, actually.
Yeah, because you never know. I actually just spoke to the son of a woman today who she had to go into a rehab facility. The rehab facility took her off of her Advantage plan and put her on traditional Medicare because they didn't accept the Advantage plan. They would take the traditional Medicare. And he went ahead. He was like, all right, that's fine. Go ahead. And then so they let me know. And I said, well, give me a call when she gets discharged so we can get her, you know, set back up on the plan that she had. So he calls yesterday. He says, okay, they just discharged her. So we're getting the enrollment paperwork together to help get her back on her plan. So she's not just on traditional Medicare. Well, don't you know, he calls me today. He says, oh, mom's back in the hospital. She fell last night and hit her head.
Oh my God.
So now she's in the hospital without only traditional Medicare and no extra coverage. So if she runs into anything else other than, you know, she needs any other services other than what the Part A is going to cover, she's in a little bit of a hard place, you know what I mean? So you gotta.
Devil's in the details.
Yeah.
Devil's in the details. All right. So I think that about sews it up, right?
Yeah, there's one more at the bottom there. Would Medicare with a Medigap or supplement be better than a Medicare Advantage?
That's kind of what we answered, right? I mean, like you said, it kind of comes down to situation.
Yeah, it's
Not necessarily better.
No, like I said, it's definitely, I think it's the it's the any one given situation. I think it really does come down to a lot of what your health is like and what your doctors accept is
What
really,
area you live in, right? You know,
yeah,
right? So,
absolutely.
you know, your budget, your, you know, the things that, like, because Medicare Advantage can be so drastic from one plan to the next, whether you can find a plan that can fit for you and the providers feel good about it, and
Right.
you know, everybody's willing to take it, and that you're dealing with.
Yeah, I think it's definitely it's a personal comfort level is what I always explain to people. You know what I mean? Medicare is definitely a little bit more flexible, Medicare with a supplement, and then the Medicare Advantage, there's just going to be more things that you have to make sure line up. That's all.
Yep, absolutely. So folks, here are the resources that support the facts that we use today in our content. Rachel will be putting them in our comment box for your later use if you are interested. And that concludes the educational part of our presentation for today. No, what am I doing here? Is that right? No, we already did the sixth grade. No, in conclusion, I don't know what happened. In conclusion, I'd like to thank everyone who took the time out of their busy schedule to attend our workshop today. I truly commend you for being the type of people that are looking to better inform themselves. I would also like to thank my beautiful, wonderful partner in business and life and special co-host tonight, Rachel Dougherty, for taking on this new role with us today. Thank you, Rachel.
Happy to be here.
Again, folks, my name is Brian Dougherty of PLC Financial Solutions, located in the Fort Washington area. You can get in touch with us if you have any questions related to our topic today, or anything else for that matter, by either calling us at 215-804-9708 or emailing us at info@plcfs.com, or you can even go to our website at plcfs.com, and where all our information is always available at all times. Also, folks, we hope to see you on our next webinar next Tuesday on October 25th at 7 p.m. We do them on the last Tuesday of every month, except for when it's Rachel's birthday, right? So on behalf of myself and Rachel, have a great night, and we will see you next month.
Everybody.